Hi, my name is Ellen Stanfield, and I'm a physical therapist at Building Futures. We have two locations, one in Ruston, Louisiana, and one in Monroe, Louisiana. Today, I'm going to be talking to you guys about torticollis. What is torticollis and what causes it? Torticollis affects a muscle in your neck. What happens is when it gets tight, it'll pull children into what we call a side bend and then rotate them the opposite direction. It oftentimes happens as a result of in utero positioning or also positioning outside of the womb after birth. Very common in multiples just because there's cramped space. And it's also common after birth just due to positioning. So it's very common, especially if babies spend extended periods of time in what we call containers. So bouncers, swings, car seats, that just limits their range of motion at their neck. Why do we treat torticollis, and why is it so important to treat early? It can lead to certain conditions and other difficulties with gross motor skills. So for instance, plagiocephaly, which is because kids are rotated towards that one direction, oftentimes they'll get flatness on one side of their skull, and that could potentially lead to the need of a helmet. But also what happens with that, it can change the shape of their skull, and you can start having malalignment of the orbit bone, the forehead, the ears. So it can actually change the shape of their skull. And if your one orbit is in front, then that can lead to vision problems as well. And we also see just delayed gross motor skills, difficulty crawling, maintaining balance and sitting. They have a hard time finding their midline because they're always rotated to one direction. We do find that the earlier we start treating these kids, the better the outcome and the shorter duration of therapy that they ultimately have. So it's so important if you do notice that your child has a rotation preference or that they have a little bit of a tilt early on, better to just get them evaluated. How do we treat torticollis? What to expect during a therapy session? We ask that the caregivers are intimately involved throughout the session. In fact, we welcome caregivers to come back during the treatment session so we can do as much hands-on with you as possible. Lots of strengthening, specifically for the neck muscles and the core. So if a baby is tight on one side of their neck, we're specifically going to strengthen into the opposite direction. With that, we're also going to stretch the tight muscle, and we're going to teach the families how to do that safely and comfortably for the baby. Also, just education regarding positioning. There's certain positions that you do want to avoid, especially if children have plagiocephaly, ways to kind of help facilitate remolding the skull, and then also just positioning to avoid limiting times in containers. Thank you so much for listening to what we had to say about torticollis. If you feel or have concerns that your child has either developed it or is at risk for it, please don't hesitate to contact our clinic and reach out and get a physical therapy evaluation. Thanks so much.